this moment to go over Voodoo floss. So this is kind of your self-help or self-massage therapist who can tack down tissue as we glide and move through a joint that helps the layers of fascia and tissue slide and glide over one another in a more efficient manner. So speaking of the knee joint, we're going to start off in a almost straight knee, slight bend in the knee, okay? You can start above or below the knee joint. In this case, I'm going to start below the knee joint. Real quick though, we want to make sure that this is in contact with the skin so that we get the best return on investment for our time and use case. But for the demonstration of this video, I will be doing it over my pants. That being said, I'm going to tack underneath the knee, right at the upper portion of calf. We always want about 50% overlap as we overlap each layer of the band and wrap around the limb. From here, I'm going to go all the way up, right below your free floating bone, called your patella. Once we reach the bottom of that patella, I want to make sure, as I go around, I'm going to skip going over the patella, okay? And then I'm going to go right above the patella, and I'm going to continue my floss application all the way up my quads. If I wanted this to be more of a quad dominant floss procedure, I would go more floss up the quad versus down on kneecaps. So once we're here, I'll get this locked in. I want to get through as much motion as possible, whether that be squatting, whether that be seated leg extension, or just flossing through flexion and extension of that knee joint. I can walk with it. I can do hamstring scoops with it. But my favorite is as much motion out of that joint as possible, whether I'm standing, flexion and extension. I can do a Cossack squat into that. But the more motion we get with the floss application, the better. That's kind of the point of this, is bringing blood flow to that area, getting some neurological and sensory input to that area, and allowing those muscles and tissue and fascia to glide more efficiently and more effectively. You can do this for up to a minute, 2 minutes. We do not want this discomfort to be unbearable, but you should feel some pressure. Once you take the Voodoo floss off, so I will take it off now. Once that Voodoo floss is off the limb, I want you to continue to move through those ranges of motion, whether it be that squat, lunge pattern, flexion extension, a standing or seated position, and just feel the difference in tissue quality and movement and freedom of that joint now.